Could you talk a little bit about what this planning group is doing? It is not in and of itself a commission. It is trying to lay the groundwork for one. So how did you organize this? Who is on it? And what have you been doing so far?
Sure. Uh, just be clear, you're absolutely right. There is no such thing as a national COVID commission. There is a large effort to try to plan one. The effort was not my idea. I was approached late last year by a group of major foundations uh, um, representing some diverse points of view. These foundation leaders thought it was obvious that after this monumental crisis, the largest perhaps to hit the United States since 1945, that there would be some equally massive stock taking to deeply understand what happened and why, and propose changes to help arm us better against such emergencies in the future. So these foundations asked me, so how would one go about organizing such a commission? And I gave them some ideas. And and what became clear right away is that this would perhaps be the largest crisis commission in American history. This is a sprawling crisis. It's tackling and understanding of this crisis is actually a harder problem than the 9/11 Commission was. And therefore, once they realized that, they said, well, obviously, an enterprise on this scale that would be working around the country and even internationally needs to be planned. So they asked me to lead a group to plan such a commission, plan how it would stand up. I then gathered dozens of leading experts from around the country, and we began consulting people who had experienced the crisis, both in the United States but also overseas, and have now conducted listening sessions with hundreds of people, all sorts of people, leaders of Nurses Association, victims' families groups, public health experts, epidemiologists, microbiologists, former officials, all to scout the landscape of the crisis and develop a picture of how a commission might go about its work, draft dozens of launch work plans with the help of a number of experts, including many at the Center for Health Security at Johns Hopkins. And out of this national group, prepare so that if a commission is created, it can get off to a quick start with a clear vision of what work needs to be done in order to provide results in time to take action while people are still seized with the need to make sure something like this never happens again. The country has not done very well with this crisis. We're moving now towards 1 million excess deaths in the United States. Worldwide, we're probably, despite what you might see in the official data, probably more than 10 million excess deaths, and could easily match that number with another 10 million by this time next year. So we're dealing with a global war of an alien invasion of a new microorganism. Our defenses against this invasion collapsed immediately, and every community in America has been fighting the invader as best it can. And we need to understand the choices people made and how we can equip this country better to stand up against another major emergency. And I think the 21st century is giving us more and more crises of this kind.